So welcome everybody. Today we're gonna see a case performed with a solution drug-coated balloon from MedAlliance, Switzerland. This device is really unique in the field. This is the latest generation sirolimus coated balloon, which obtained a CE mark very recently. The technology ahead is really promising in my opinion. First of all, it elutes sirolimus, which is a very safe and effective drug reducing restenosis. Then we have a proprietary micro-reservoir technology which allows the deliverability of the device and of the drug and its release for the first 60 to 90 days after angioplasty. So this mimics a sort of DES-like release of the drug, which is unique in this technology. And then we also have a cell-adherent technology, which is spelled CAT. This is a proprietary amphipathic lipid technology which has the aim of binding the microreservoirs first to the balloon and then, upon inflation, to the vessel wall, allowing the release of sirolimus for 3 months. Another very important item regarding this device is its deliverability and trackability, which is really top in the DCB, among the DCBs available in the market. So I am going to present now the case of a 72-year-old male, hypertensive, dyslipidemic, and smoker. This patient suffered effort angina in the last months, and this angina became unstable because it worsened in the last few weeks. You can see here the initial coronary artery angiogram for the left system, which shows clearly a diffuse and a severe disease involving the LAD, proximal, mid to distal, and the circumflex, and also the obtuse marginal. So we decided to treat this patient due to the diffuse disease with a hybrid therapy, including drug-eluting stents and latest generation drug-coated balloon. For this case, we used latest generation drug-eluting stent and the SELUTION sirolimus coated balloon. These are other two views showing the complexity of the disease, especially in the proximal part of the LAD, with a trifurcation involving a big, very large septal branch and a good diagonal branch, with some ectatic vessel at that place. So we decided to predilate all of the lesions of the LAD with a 2.0 and then a 2.5 balloon. Showing this result, then we decided to put a drug-eluting stent in the mid to distal part of the LAD because we had a large dissection with impaired TIMI flow. This is our habit in this case. And then we decided to treat the proximal part of the LAD with a drug-coated balloon. Why we took this decision? We took this decision because we didn't want to close all of these side branches, including this large septal branch and these two diagonal branches. This is the SELUTION SLR DEB inflation. You can see here that the lesion is correctly prepared because the shape of the balloon is adequate to inflate and to deliver the sirolimus to the vessel wall. This inflation took almost 60 seconds, which were quite well tolerated by the patient. So with this time frame, we were sure that all of the sirolimus was delivered to the vessel wall. Then we had to complete the angioplasty with the circumflex and the LAD and the ostial LAD and the left main with the two drug-eluting stents due to a dissection. This patient had very complex lesions and very ectatic and fragile vessels. So this is the final result with a drug-eluting stent in the mid to distal part of the LAD, SELUTION SLR in the proximal part, sparing all of these side branches. And this is the great news. The septal branch was okay, and the 2 diagonal branches were okay as well. In this final slide, you can see where we put a drug-eluting stent and where we put 2 solutions drug-coated balloons in the diagonal branch and in the proximal LAD. And this is the angio peak showing the final result. We were happy to use the SELUTION SLR drug-coated balloon here because we are pretty much convinced of the new technology ahead this device. We are pretty sure that after 3 months of release of sirolimus, this lesion will be fixed correctly with some lumen engagement, lumen enlargement, like we have seen in other cases. What is important to understand from this device is to collect some clinical data. We are going to do it with several studies, especially in the de novo setting. But what I can tell you now is that the deliverability of this device is really high, and this device is able to reach any type of tortuous vessel. But please remember well that when you use a drug-coated balloon, you need to always correctly prepare the lesion before delivering the drug. Thank you.